Hi, I'm Dr. Chad Larson. I've got a private practice that focuses mostly on orthopedic issues, sports medicine, and environmentally induced chronic inflammation and autoimmunity. The reason why testing intestinal permeability in autoimmunity is so important is because leaky gut is a real gateway to autoimmunity. When there's compromise to the intestinal barrier, antigens that would otherwise not be allowed to cross the barrier system would be allowed to cross, initiate a whole cascade of immune activation and inflammation, which could eventually lead to autoimmunity in certain susceptible individuals. The Array 2 really is a product of the latest information in laboratory science. No other test that I'm aware of really compares. The thing that really makes Array 2 especially unique is it's a direct measurement of the integrity of the gut barrier. In other words, they're testing antibodies to markers and proteins that are actually involved in the barrier system. And so when there's elevated antibodies to one of these markers, it's a very direct evaluation that there's compromise to the intestinal barrier. Additionally, what I really like about the Cyrex Array 2 is that they're also measuring antibodies to LPS, or lipopolysaccharides, which is a component of the membrane of gram-negative bacteria, which is a key underlying cause of leaky gut in many people. When actomycin antibodies are elevated, it means that there's compromise to the transcellular pathway. Actomycin is a complex of structures that helps to regulate the opening and closing of the tight junction of the intestinal barrier. And elevated antibodies to actomycin indicate that there's been inflammation of the intestinal epithelial cells and compromise to that transcellular pathway. When antibodies are elevated to occludin and zonulin, that indicates compromise to the paracellular pathway. Occludin and zonulin are protein structures that are involved in the tight junction of the intestinal barrier. And when antibodies are elevated, that means that there's been compromise to the paracellular pathway, which means that there's intestinal permeability, which sometimes we refer to as leaky gut. Lipopolysaccharides, or LPS, is an endotoxin that's produced in the outer membrane of gram-negative bacteria. And when elevated antibodies to LPS are detected, that indicates a dysbiotic environment in the gastrointestinal tract, meaning there's an imbalance of the good and bad bacteria. And when LPS builds up in the gastrointestinal tract, that's been known to break down the integrity of the gut barrier. So this is a really important marker on a leaky gut test. You want to know if LPS is one of the potential causes of that leaky gut. So once LPS is outside the gut where it's not supposed to be, it's been known to be a significant inducer of inflammation and immune overactivation. When there's breakdown of the intestinal barrier, multiple factors really need to be considered. Protocols are going to vary from case to case depending on the condition. But what we know of is that diet really needs to be the centerpiece, because diets that are high in sugar and refined grains and refined carbohydrates promote dysbiosis. And when there's dysbiosis, there's overgrowth of gram-negative bacteria, there's overgrowth of LPS, or lipopolysaccharides, which leads to inflammation and intestinal permeability. And when there's breakdown of the intestinal barrier system, there's certain nutrients that we know that help to repair the gut barrier. Certain amino acids like L-glutamine and N-acetylglucosamine. And then also we want to support the mucous membranes with the demulcent mucoprotective type botanicals like slippery elm, marshmallow, aloe vera. We also want to help support the integrity of the mucosal immune system. And nutrients that are good for that are like vitamin A, vitamin D, probiotics, and even fish oils.